Hey, welcome back, everyone. Today we're going to talk about Beata Kowalski. Her family's lawsuit is currently in the court and on trial. So, if you don't mind liking, well, if you do like this video toward the end, and I would love it if you would subscribe. We are just 40-ish people away to our 500-mile milestone that it blows my mind. So that's very exciting. You may have become familiar with this story of Maya from the Netflix documentary called Take Care of Maya. And I learned of it several years back. I'm going to take off my glasses for a minute. Probably have to throw them on too. But I've had, as a speech therapist, I've always had this odd concern about, which we call them Munchausen syndrome. And in this case, it can be called Munchausen syndrome by proxy. And the by proxy is typically the parents or a caregiver. A newer term that's often used is factitious disorder by proxy. And obviously the factitious means that someone's malingering or pretending. So it's a very, very odd case that we have here and a very sad result. We will talk about their first settlement. We will talk about one thing that I really want to highlight today is the testimony from yesterday from the PT, the physical therapist that worked with Maya. There was a video that was shown to the jury that was very powerful, very powerful. And let's see, we'll talk about, there were 2 prior doctors that gave their opinion and didn't have any concern about the parents causing any kind of problems. What else? Oh, we'll talk about the complex regional pain syndrome, which is sometimes referred to as CRPS. And we'll get to that in just a minute. And let's see, what is our last part? Looking at the dates, and we can talk about that now and what happened in this particular case. So, in October of 2016, Maya had a flare-up of a Beata Kowalski had the flare-up of a little-known, very rare syndrome that's called complex pain syndrome. Complex regional pain syndrome. So it's not a pain all over your body. There's certain sections that can be debilitating. And they had, her parents, Beata and Mr. Kowalski, I'm sorry, I don't remember his name, had previously worked with 2 doctors and did somewhat experimental, the therapies that are normally associated with this can be acupuncture, physical therapy, massage therapy, and almost a restricted area that shows some help with ketamine. Now, the drug ketamine, is actually from the 60s. It was sort of a street drug kind of hallucinogen. And so it's obviously something that is held in reserve and to look at. It's sort of like if someone has pain, we don't throw them in there with morphine. You know, we check and see what kinds of things would work prior to that. And then if that's not solving or treating the issue, then we would go to something stronger. So in the past, they had found that ketamine at high dosage levels would be able to reduce her flare-up. Because there were times that Maya was totally normal, like any other child that you would see. And with a massive, like unexplained stressors can cause it, flare-up, she wasn't able to walk. Her feet were turned in like a pigeon-toed, and touching her legs hurt, and her struggle was very significant. So, I think it was when the hurricane was coming in, that was about the time Maya had just experienced a debilitating flare-up of CRPS. And her mom was a registered nurse and very familiar. She did a lot of research and obviously wanted the very best for her child. When they took her to John Hopkins All Children's Hospital in Florida, Beata, her mother, was very forceful to let them know she needs ketamine and she needs a very high dosage of it. So, with this type of concern, when parents come in sort of not listening to physicians and insisting that they know everything, you don't need to do any tests, they understand this and just trust me, then it does raise eyebrows. And it makes sense that it might raise eyebrows, because occasionally we do have the mental health disorder that a person could do it to themselves, or a caregiver could make a medical issue a lot worse for attention. And they want it to be the center of attention. And I mean, something as simple as, so you have a cut on your leg, and you've had a couple of stitches. Then if this mental health disorder is part of who you are, then if you feel like you're not getting enough attention and that need is very powerful, you may take dirt and rub it into your sore to make it worse, rather than treating yourself with kindness and following the doctor's orders. So in this case, and I'm sure a lot of you already know so much about this, they were looking at it as Munchausen syndrome by proxy and targeting the mother. That Beata was wanting a lot of attention, was what the doctors were suspicious of. They were suspicious that, which is another thing, is they usually know so many terms and details of medicine in that particular area. And she was also very aggressive. Beata was very aggressive because she obviously didn't want her daughter to be in long-term pain when she had experienced in the past few years a ketamine treatment that they did for how many? 6 days, like an extended treatment, and put her in a coma to receive all of this ketamine. And if they didn't have her in a coma, they were saying that she would have lots of hallucinations and it would be very difficult for her to stay calm. So it was almost miraculous that she responded so well to the ketamine. And it's just a very sad case. They eventually settled with, and I'm gonna have to throw my glasses right here, with this Smith, who was working as a contract through a nonprofit, Suncoast Center, that was very aggressive and felt like she knew and had the most experience with working with this mental health problem. And she was very forceful. And we found out as this trial has progressed, there's been some information to come out that this particular lady has also been, let's see, how would you word that? She's also been aggressive with other cases that are similar. Now, we don't know the outcome. We just know that it's very, very rare. This complex regional pain syndrome is very, very rare. So putting those two together would be hard to tease out. And so their initial concerns, I am fine with. I can see how someone would think that way and start kind of gathering some data. But if you've watched the Netflix documentary, you already know, because it shines a lot from the parent's perspective and the family's perspective. And so pushing this disorder and saying that it was the factitious disorder by proxy, they reached out to the child welfare services and severed the parents' rights and put her in the care of the hospital, because they testified that they felt like Maya was worse when she saw her mom. There was one occasion, they didn't show it, but where she was working in therapy and then her mom arrived and they didn't feel like she was expressing that she was having some pain. But when her mom arrived, she started talking about the pain. And I'm sure as a child, she probably felt more comfortable telling her mom that she has the pain. So I think this trial is set to continue for a couple more weeks. Now, it may not. It looks like I think the judge is awesome in this trial. And it looks like from watching the trial that they're getting their calendars ready, at least for this week and next week. So maybe we'll have a conclusion by then. And so they're currently suing Johns Hopkins All Children's Hospital. The previous lawsuit, they settled out of court for $2.5 million. This lawsuit, they're suing for $2 million. Huge, huge numbers. But I think it was an important case to bring forward for our country to learn and people in the world to learn about how careful you need to be of assuming something is happening when you don't have the full picture. Like working together as a team and accepting her information. She was previously treated by 2 doctors that had both used ketamine. But if I'm not mistaken, and put it in the comments if I am mistaken, I believe they went out of the country to receive that treatment, like an experimental treatment. So that may be the tricky part, and I'll just have to check into that. And if you can put your comments below, I appreciate it. Okay, so the big news right now, in my opinion, is that the physical therapist went on stand, very polite, very kind. She was young during that time. She took great notes, but the one hit against her was, I think, if I understand it right, which I see this some in speech therapy, there's a autofill section. So the professional that had treated them earlier had a comment that did appear to support the by proxy concern. So when she's typing in her notes, that part is on the form, and she was asked about it. And she explained that being a young physical therapist, she can see how it would have been possible that she didn't notice that aspect because that part of the form was not highlighted. So that was the only downside. But when she showed the video, Wow, I think most people would agree that Maya's not pretending. Maya's mother, Beata, is not pretending. I mean, yeah, if I were on the jury, I'm pretty sure I'd have my mind made up by now, but I'd still be open to information. But that visual of probably 30 minutes maybe of the physical therapy session was powerful. And I'll tell you one other thing I like about this judge that I haven't seen. I love to follow court cases. And by the way, on this channel, I know that it's kind of weird that I've combined first year flower farming with court cases, because it doesn't seem like those mesh at all. And I might need to separate that out and figure out where I need to have a new channel. But that's just happened to some of my interest. And so I meshed that together a few times. And if you want two channels, let me know. And then we would need to figure out what we could name the one that follows court cases. So I hope I remember what I was getting to. Oh, the thing I like about this judge is that he allows the jury to ask questions before the current witness is released. So they'll write it down. If they have some questions, present it. The attorneys will take it to the judge. Then they do a sidebar and talk about it and make a decision. And typically, so far, it looks like they've just approved those. Oh, I'm getting a call. I got to turn that off. It looks like they've just approved those questions, which were incredible, well thought out questions that helped clarify some things. And they did that on 2 occasions with this. Well, they came up with a follow-up question is what they did for them to pose to this physical therapy witness that was on the stand yesterday. So we have a little more of our trial to go, and then we will then the jury will be sent to deliberate. So I'm sure you already know how court cases work. And if this information is something that you appreciate, getting kind of updates on breaking information or sort of a summary of some current court case, then please subscribe. And then I would love it if you would like. It's just quite incredible that this community is so supportive. Okay, I appreciate you guys. I hope you have a blessed day.